Good morning, sir. I'm Princess Dayan Almudal and I am here to demonstrate to you the procedure of perineal flushing. Perineal care involves the washing of genital and rectal areas of the body. This prevents from irritation, odors, and infection. Now, we're going to prepare all the necessary equipments. We have the basin. Try to assume that this is a bed pan. We had the pitcher with warm water. We had the kidney basin. We have the 7 cotton balls and other 7 cotton balls for the antiseptic. We have the forceps. We have the perineal pad, the clean gloves, and we have the draw sheet. Preparing equipment help us to save time and energy. After preparing the necessary equipments, explain the procedure and treatment to the client on how she can participate. Provide the client the opportunity to ask further concerns and of course establish a good rapport to the client so that she will be comfortable during the assessment. Ask the client on how will be called. Now we're going to perform the proper hand hygiene by washing our hands with clean water and soap. So performing proper hand hygiene control the spread of microorganisms. We're going to wash our hands with clean water and soap. Hello ma'am, good morning. I'm Princess, your caregiver for today. May I know your name, ma'am?
Melody,
When is your birthday?
December 24.
Is that okay with you, ma'am, if I'm going to check your wristband?
Yes.
Ma'am, the procedure that I'm going to do is to perform the perineal care. This is to remove the normal secretions, the odors, and of course, to prevent from contaminations of your genitals. I will be touching some parts of your body, especially your genitals. Is that okay with you?
Yes.
Okay, ma'am, do you have any clarifications or concerns?
None.
Okay, thank you. As you can see, ma'am, I close the door. I close the door. I close the curtain. So na other people can see us and especially to respect your privacy. Lock the client's room to provide the client's privacy. Now we're going to cover the body and the legs with the bath blanket position is at the cover of her head, and other is the corner of her feet, and lastly at the corner of her side. Now we're going to place the blanket at the corner of the head and the corner of her feet. And then lastly at the corner of her side. So now, position the client into the dorsal recumbent position with her knees flexed and put the client on a bed so this prevent the bed from become soiled. So now, ma'am, I'm going to position your legs. Now we're going to bend your legs. So now, drape the patient, exposing only the area to be cleaned. Minimum of exposure, lessen the embarrassment, and of course to provide warmth. So now, let's inspect the perineum and flush the perineal area with warm water. So using the warm water in the pitcher, you're going to wash the perineal area. So note for any particular inflammation, swelling, excessive discharge or segregation from the arteries and of course the presence of odor. So warm water is used to prevent from chilling and dissolve the blood clots. Okay, now you're going to get the cotton balls, soak in a cleansing solution using a pick forceps to maintain the sterility. Now, we're going to clean the external genitalia starting from the midline of the mons pubis. Going to the anus. Don't forget to never replace a stroke to prevent from contamination of area. With the second cotton balls, clean starting from the mons pubis in a figure of 7 by way of external labium towards the anus, then discard the secretion, tend to collect around the labia minora, facilitate the bacterial growth, starting from the mons pubis, going to the anus. Then, we're going to discard. Do likewise on the opposite side by next cotton balls. Now the fourth cotton ball, clean starting from the mons pubis in figure of 7 by way of external labium towards the anus, then discard. Do likewise on the opposite side with the next cotton ball with another cotton ball. Then discard. With another clean cotton ball, you're going to clean the groin starting from the groin going to the thigh. After thigh, use the another side of the same cotton ball for the near groin, then do likewise. Discard. Then do likewise on the other side. Discard. Now we're going to flush the perineum thoroughly with warm water. Now, using the 7 dried cotton balls, we're going to dry the perineum with the same stroke above the moisture, support the growth of the microorganism. Discard. And then do to the other side. Then we're going to dry the groin. Now, let's remove the bedpan gently and turn the patient aside if necessary. Turn the patient on her back and make comfortable spray with antiseptic as needed to promote healing. And now we're going to put the perineal pad with up-down motion as needed to prevent the contamination of vagina and urethral from the anal area. Okay, now we're going to put the... Clean all the materials that you use and don't forget to do the hand washing. Record the treatment done to the client and discharge observed to the documentation purposes, that the procedure was done and means of communication.